Hello everyone, today's question is most dreadful complication of Kawasaki diseases. Options are lymph node, thrombocytosis, cardiac involvement or rash. I'm giving you 5 seconds to think. So correct answer of this question is C. We'll learn Kawasaki disease as it occurs in age group of children less than 5 years. Remember that. Also, I'll tell you, remember that fever remains in this is more than 5 days. Okay, if a child coming with symptoms of having fever more than 5 days, that 5 you have to remember. Okay, so to learn this, the dreadful complication thing, we'll learn it as firstly the mnemonic. Okay, that is what crash and burn. Firstly, what we say, okay, another name of Kawasaki disease are, there are two names, right? Number one, infantile polyarteritis nodosa. From this we can say it is a vasculitis disease, and what we know, medium vessel is involved in this disease. There is inflammation of medium vessel. Okay. Second name is mucocutaneous lymph node syndrome. Remember both these names, as that one was PYQ once in AIMS. So now we start the mnemonic. Okay, mnemonic from C, it is conjunctivitis, that is bilateral, and from C here you remember that it is coronary artery aneurysm. And as the question is also saying that cardiac involvement, from here we learn it as it is most dreadful complication. So child coming you having fever more than 5 days, and the age group is less than 5 years, and also there is cardiac involvement, like that you can say. Okay, and also that rash and strawberry tongue, as we know this is also present in Kawasaki. We'll learn it in that mnemonic. Okay, most dreadful complication. So here also one question solved. The investigation that is most important to monitor is what? As cardiac is involved, so what investigation you will do? That is most important investigation is ECG. Okay, here we learn again, come back to mnemonic. From R it is rash, from A it is adenopathy, and that is what? Cervical adenopathy, and this is unilateral, remember that. Okay, from S it is strawberry tongue, that is the most famous question. Just think where strawberry tongue also find, in which disease? Hands and mouth, not mouth actually, hands and foot are involved, that is what? Erythema. Okay, from one it is fever, and fever is what? More than 5 days. Okay, strawberry tongue also found in our most famous disease from S, that is scarlet fever. Okay, in also toxic shock syndrome, remember that this was also PYQ once. In all these three diseases there is what? Strawberry tongue is C. Okay, the last point regarding this disease is treatment, and the treatment of this disease is we can give high dose aspirin, and second one is high dose IV immunoglobulins. Okay, and this one is also PYQ of FMGE, of AIMS. Alright, I'm also touching all the related PYQs of this disease in my story. Just check it out. Thank you.